Hi, I'm Dr. Costanza. Thank you for taking the time to view my presentation on how lifestyle can influence your genes, ultimately affecting your health and well-being. Your health can be summed up in this simple equation. Structure influences function, function influences your genes determine your health. This may not mean much to you at this time, but I will simplify its importance meaning in the subsequent slides. Sit back, relax with your coconut water and your organic popcorn, and enjoy the show. This slide somewhat speaks for itself. When we use the word environment in functional medicine, we could literally mean environmental exposure, but also mean all aspects of lifestyle as well. The itemized list defining structure here are not in any particular order. In subsequent slides, I will review each one. Our perceptions and beliefs, right or wrong, have a huge impact influence in our genes. Remember, what you focus on is what you're going to manifest. This is true not only pertaining to our health, but in all aspects of our lives. This may sound somewhat esoteric, but I find both scientific and empirical evidence supports these principles. On a similar theme as the previous slide, the stress we mostly create within our own minds has a huge deleterious effect on our body. Unfortunately, the body doesn't discern little stress from major stressors. Most people think of stress as the major stuff that happens in our lives. However, someone could simply get up in the morning, have a busy mind, the what-ifs, the coulda, shoulda, wouldas, feeling a lack of control in their lives, lack of spiritual consciousness, a little anxiety, fear, depression, seeing the glass half empty, awfulizing, that's my own word, etc. And their body can reside in this continuous fight or flight mode. Due to principles of biochemical individuality, there is not one diet for everyone. The diet for one person does nothing for another or could even make them sick. The diet that works for you now may not work for you 5 years from now. One needs to take into consideration one's metabolic type, one's ancestry, one's inherent strengths and weaknesses, etc. Think of food as information signaling our cells. As an example of what not to do are those who use artificial sweeteners. They may not be aware they are increasing inflammation at the cellular level. They're also sending a message to the pancreas that sugar is coming, which does not occur, therefore confusing the autonomic nervous system and the release of insulin. Hippocrates, the father of medicine, said, "Let food be thy medicine and medicine be thy food." I can tell you he wasn't talking about pharmaceuticals. Vitamins and herbs are really a concentrated form and extension of food. One of my most popular custom herbal formulas, called Digest and Remove and Rescue, has in it dandelion, cardamom, clove, oregano, garlic, and a few others. As a holistic clinician, we use these supplements to re-educate the cells, reset the autonomic nervous system, heal the gut, balance hormones, balance the neurotransmitters and modulators of the brain chemistry, upregulate the immune system, reduce or eliminate inflammation, so on and so forth. Sleep is pertinent to our health for a number of reasons. According to Tufts Medical Center, less than 7 hours is considered sleep deprivation. When we sleep is also important. Ideally, we should go to sleep when it gets dark and up with the birds. That would put us somewhere between 8 p.m. and 5 a.m. Keep in mind we need at least 30 to 45 minutes of deep delta level sleep to upregulate growth hormone, which occurs typically between dusk and midnight. Human growth hormone recharges our batteries. It's somewhat the fountain of youth to the human body. Also, the body is metabolically most active during the night when it's repairing, restoring, and enhancing immune function. In a nutshell, we need to sleep according to our circadian rhythms. And lastly, keep the bedroom dark and shut off those blue lights from all your electronic devices. Studies have shown they increase the risk for cancer. There is not much more one has to say about exercise. Man is made for motion. We need to keep moving. The health benefits are tremendous. Most important, it helps us to reduce inflammation, which, as you are probably aware of, increases with age and disease. Our personal habits play an important part in our health. Like anything else in life, choices we make have a profound effect, positively or negatively influencing our health. According to the principles of Ayurveda, the body likes routine and regularity. It wants you to eat, sleep, eliminate, exercise, have sex, etc., about the same time every day. Consistency is important. By the way, those who suffer from addictions often have low L-dopamine, which is the neurotransmitter influencing the left side of the brain. One may have a vitamin B6 deficiency because vitamin B6 is necessary to metabolize L-tyrosine, which is an amino acid, which is the precursor to L-dopamine. Let's talk about ergonomics. Check to see if you bend or curl your upper back and are leaning forward. Posture is so important. Remember, structure influences function. Many years ago, I had a problem with TMJ. I figured out when at the computer I was slouching and my mouse was about 2 feet away from my body. By correcting my posture, the TMJ disappeared forever. Talk with any chiropractor or physical therapist. They will explain the mechanism of how this occurs. We refer to contaminants in the environment as xenobiotics, or in some cases specifically xenoestrogens, which increase the risk for cancer associated with endocrine organs and breast tissue. In some cases of xenoestrogens, the chemicals act like fake estrogen and can occupy the endocrine receptor cells, such as the case of breast and uterine cancer in women and prostate cancer in men. These chemicals and heavy metals we are exposed to on a daily basis are ubiquitous. They are everywhere. We all have them, but the question is how much? Genetically speaking, some of us are good detoxifiers and some of us are not. It comes down to the rate of exposure buttressed against our body's ability to detoxify. If you are not a good detoxifier, you are not doomed because there are medical foods we use in functional medicine that can step up detoxification within the liver and the cells. In slide number 4, I listed the different aspects that make up structure, but no particular order. Then the subsequent slides, I went over each one. This current slide case study is an example of how I prioritize the constituents of structure and how they apply to an individual who suffers from symptoms of disease, addiction, and chronic illness. In the next slide, I'm going to ask you to prioritize the list in relation to your own symptoms. What order might we arrange structure in relation to your unique chronic symptoms? Maybe ask a significant other, loved one, or close friend if they agree. Once you feel confident with the order of your list, most important at the top and least important on the bottom, set up your own daily program. Take control of your own health by education and being proactive. This slide is a crash course in cell biology. Read what Cellular Susie has to say. Our genes are within our DNA are within our chromosomes are within the nucleus, of all of which is within our cells. Functional medicine utilizes principles of systems biology. As one of my professors has said, you don't have a patient with one or two bad parts. The weakest link can systemically influence every system, cell, and molecule of your entire body. We are not just made up of a bunch of parts, which ascribes by Newtonian principles, but we are more like those of Einsteinian philosophy, that is, we are made up of fields of quantum energy. Therefore, in functional medicine, we look for the underlying imbalances. By correcting these imbalances, we are addressing the underlying cause versus just managing symptoms, which can only go so far. I love this slide. It was once thought that the nucleus was the command center of the cell. As a result of the Human Genome Project and the work of Dr. Bruce Lipton, we know today it's the cell membrane that is the command center. And what influences the cell membrane is structure, that is our environment, our lifestyle, as defined in the former part of this presentation. The aqua-colored protein projecting out of the cell membrane are the cell's antennas picking up signals from the environment, directly sending messages to the nucleus containing our genes. Those signals could be from our perceptions, our beliefs, the food we eat, chemicals from the environment, any combination or all of what I defined as structure earlier. Remember, the health equation we started with: structure influences function, function influences our genes determine our health. We know today that we can influence our health by 90% or more by the choices we make and how we live our lives. Time Magazine, January 18th issue, 2010, supports functional medicine and the new science of epigenetics. The front cover featured article states, "The new science of epigenetics reveals how the choices you make can change your genes and those of your kids." Functional medicine has had the greatest influence into the fields of epigenetics over the past 20-something years than any other discipline in healthcare. Thank you for taking the time to watch this presentation. I hope you've enjoyed it and benefited from it. Best in health, Dr. Al Costanza.